Assalamu alaikum bari Gambia nolu to mo kadi parole ti tala murtana jampi pour narsi kacha continue ngamen commencer nun last week kacha nyin be kacha men ke ka to mu diabetes tati mande kol ka fa sukur kuram. So last week ndiyam ta diabetes la sifa fulol men kamol muta holen type 1 diabetes ti anin type 2 diabetes nga foko nin diabetes sukur kuram problème o ñim be nata diki men wala in chemical me ka fay ko insulin ñim balo men ka dada balo la parts men ka dada organ yin atom pancreas lati o pancreas abe na kono batolo kono ni diagram o jube digestive system ay duma jele so pancreas wala ka insulin ñin dada o insulin ni do morta sukro ñin kete balo la yelo kono o insulin na ka sukro ñin ta ya drive a dundi cell sol kono primary source of as energy semboñi so wo pancreas ni ida nati nyata comme balola kere jarol ya kele yama insulin dada walem type 1 ti so ida type 2 walem insulin bijele barama siawo nyama pour kala do koke wala dice insulin resistant mais alan ko cell sol dia resistant to the insulin ni men dada pour balo ya use pour acide ma ko no sembo so ngo kachaleke so bimbe continuer na kachala the signs and symptoms of diabetes fala wala ndeni sukuru kurang so ite kamune fili balo kono andum fanang be gestational diabetes fala wala diabetes me alon koko akamus kono malmuda so banna kacha dat la wol to follow de nga continent so na video e jam fa baagi so gestational diabetes wala sukuru kurang de men kamus kono malmuda ya jiko ni sukuru kurang men kamus kono malmuda aka musukona malmuda ni kono tata lokum natambita lokum one so e kaje ni be screen na kay balo taste ila yellow taste fonye sukur kurang belale e ka ken ni muso wala kono fotata lokum one ni nan kata between lokum one ni nan and lokum one ni say guidelines will all pour ka mari taste ni sukur kurang la but most of the time lokum one ni nan ni kono fotata jele ka taste roke so yaje ko ni diabetes kam sukon mal be screen wala guidelines ti silol me ya itande pour ni muskon mal docteur be muskon mal tol te kiyal ya all itande because ya jela ko molu ni kono bela ni en sukur kuram soto wado pour ka symptom ho soto nyata men fi lebalo kono with other diabetes ka je ko wol buko o symptom ho soto so wala na across board mo be ni kono bele be wi stela pour ñu sukur kuram pa bela le ban fatela andi nata fako wado muskon ma dol bije ika kono ta bari ika ñi symptôme lon wado itol kala no ko diabetes belale doctor o kal sute juna ko ñi sukur kurang belal because wolu at most of the time mo nekake sukur kurang ñi katari la baraman diagnose comme sukur kurang belal before ko nota bari ita malon ko sukur kurang bele nene me testé wala ni nata ko nota before ita la loko muwa wado ka sute bala ko sukur kurang belal so ni alum most of the time mol men yalan ko ye sukur kurang sute bala before your diabetes screening kake ni kono be lokum nan kata janni wakasi most of the time ya jela ko jama wo mari diabetes katrala already before ala kono ma ya isi so inata fok ni gestational diabetes haka common mol kono men yalan ko inata kono ta uyatre ila ikiba yata comme sanji tan saba anin lulu kata sanji tan nani muso men yo soto inata kono ta they are at risk for gestational diabetes wala men ka sukuru kuro men ka muskona malmuta ina taji fanan ko musol men yanan ko balo soto before kono tay balo soto pake wol fanan they are at risk ani ni la family history fanan bije comme itala ini mol men den ta yelola ni sa si falbe kono wada si mutanole ni kono ta andi yaje ko fanan modol bije ni ata ina kono soto le no ni sukuru kurang ye muta so inata bulu sukur kurang ni nata kenda because wakakele bari la subsequent pregnancy coming after wo inata konota kotenke imari you are at risk for ni gestational diabetes for the new sukur kurang men kam musul muda inata wala fo and kaje ko musu kono malbe ni screen ni sukur kurang la ike treatment no lay doctor be kala jaral silo la pour membe mako lay ni la dindingol because no wota ni sukur kurang nayi mutanin kono bela wada kaman torol kele so kaman toro ko dol menke wala musu kono ma ni sukur kurang e muta wato idunga ka wari kono le e ka fa microsome ya don si bora no kono kono bakale so nu wakata be koleala le primary ye safe delivery so wala ye tingo soto me alon ka so niata wala bulu kata pake waka koleale so niata mari be village solto hisaji doctor e screen and ye ni suspect ko dingo be warale kono kono le ndu sukul kurang be la le ba fle ne ko te tabulu al pitan bado ben alon ko musula doctor ol sitaraje isi ma ko no ye bulu kayra kono iteni dingo le kan mante ro soto je cause ni nata wulu ni sate ringolto abe koleala le ni ma wulu no fay so amari foi operation o need wala kudol ni pour dino ni fintina go be koleala so ni atra ye diagnosis ko ne ko ni sukul kurang be la nun kono be la andi dingo be warale kono we dingo warata je won notice junale ni ko ta wulu banjun nyanta fere kay ta banjun janninti ngo kima ila at least la 6 weeks so before la wulu bato kata sutu ya lopitano men na ye rifaji ni be bolon kono le ko ta wulu bansa imari nyanta fere kay ta yep ta bansa before tingo kima ila sa toto pour get a life sip and in the no in the life and in other injuries me is also to know in call kono pour isi tankandu no wala inata je fanan ko musukona ma ni nyim fen ko bela ni gestational diabetes bela ye men fanan cross je ka jele ko mari yo be at risk for preeclampsia fanan musasa dolti aka ke musukona ma la sasa la woti e ka je ko mari la yelo kasele preeclampsia musasa te musukona ma la yelo kasele be pare ka je musukona aka mutani kono tambita lokum wanda kata santo yo ila yelo kasele be pare wade bloni sumul fanal kayiti andi ka chemical do tale ni yela sumna tasti ka chemical do je ka foy protein me yalon ko kam nyena tarelo sumna kono so wo aka man tora kol nati musukona mala bodo so ya jele ko nimmo le nyi sukur kuram so nin kono bela nin sa dol fanam bije asa tindale yol soto no so be screen na ye monitor bela comme ñum bulu si yito ni si yito akaka musu ko ma la manke ko preeclampsia comme ñim medical sasal be ñame wado i comme ke ñi sasa do to saji ñi sasa do to bari isi overlap symptoms so si overlap ra manke ko ni singo yitita bulo yitita o preeclampsia be la no they will do for the test be testerol ni mister dol kala pour ko diagnosis ni ascertain ko wala be la para important la pour ñin ko no be la definitely marita la pitan pour isi tester yi ñin ko wala be la inata je fanan ko muso me yaran ko nin gestational diabetes bala nin amari nata wulu ko lay bi monitor la because ni wonte ika jele ko dol ka continue le diabetes soto yin sukur kurang soto hanata ko no botele continue wo nyama all day life yin sukur kurang soto dol ta ka resolve le ni wuluta already yin gestational diabetes ka resolve la ka bojele pare ila doctor lo bi ma ko no la ke teste wala ke monitor ka make sure ko ni sukur kurang a botela le after bri wuluta wala na continue ta ye ke treatment wala ye borol dila ye ke jata kende londi jata kende silo ka membe de makoyla so ni nemu gestational diabetes ni tamande mo nga fote so kolaje last time bringa sukur kurang ka man tora jamala ke mol palo kon comme last time nga fo nyame nabe mola ikatu min la wato wati be pare fane katu sumuna la wato wati so wo mi ngame ka ke wato wati because sukuro ni ala concentration of that mari la yelo konal so nu wakata mari katu minna be pare katu sumuna la fana indu mari fana sumuna aka concentrate sukuro ni wadon ka je ko ni mo ke sumuna bandata wado kalol kana je so niyo je dala satra ita lopitan yi balo kiskis be pare ya je ko ñun sukur kuram fana nabe molla imari ni kalabara ni especially ni man treatment ole kalabara comme nga fa ñame ñun sukuro wala ka sembo di molla balo sel sayos but because insulin nem problem ote ida man sotole wala insulin men bije amansia wala insulin men bije is resistant to it so imari ni ibalo boka sukuro ni use no pour sembo soto so balo ni kana ibalo la kengol aka wolle use as alternate source of energy pretty mari si sembo soto no so ako fat sol men breakdown imari kana kala bara so isa je si labara itu minna itu sumnala be pare wado aka molla organ sol muta especially inya because sukuro ni concentration of siatale and sukuro ni comme ngafa nyame mo ak yelol ka porsilo menna ako silol ni fana wada kiti nyale on sukuro ni sita deposit imali nyala pan men ka jubero keno asta wo blood vessel men bije ayi damage a deposit kije imali ni man treatment ola nuwol nata siyaje imari nyabikeji imari nyasi kankan ni man na jata kende ya soto yeta ye o treatment ol ke ye nyal da ye la diabetes control na mete mari si problème o soto no le foy finki aso fanan kinol yo ya jenyen sukur kuran fana akamol ko kilul mutalika foy kidney comme nga fa nyamen sucrosis ya balu kono barbaro nyanda fere kelal pour ko sukuro nyin ka excrete ka bondi balu kono so kidney la do ko fana mu wolti ibajere num weta kidney nyin yelol silol men ka borije ko kilol nyin supply as wol fana problem o kela and ni kidney nyin ni akuntu ya jube microscope kono ka jela ko kidney kamantal ko tamew so wo tamew wala latu je cells blood vessel cells ya taje wado nyin sukuru kuran ko wol fana tinyale so imari ka problem o soto fo ila ko kilol boka wo kon ko kilol na fa wartal ka toxinol ni fingol fil tambalo kon so nuwo nata ke mari sinata on dialysis because ni kidney la tinyati man ta on dialysis imari ibe man to ko so je fo asitin na ko imari ni yotuje so ñun sukur kuran ko wo be kele be pare ñun sukur kuran fana aka molla nafsol mutale ila comme nafsol e fengol le muti men yalan ko itol ka kibaro le di mol palo kono ka boy la brain to ka di balo le parso da ka kibaro di ni fengol mana kandite kala no ko nyin kanditale ni fengol mana smare kala ko smayatal ako kibaro le ki so kaje ko ñin nafsol ala yeda da nyambe ka ko basatole ika murrangol sotole bari men ka fota singol nimbul kon ngol to tem ika murrangol men soto ten wol buka tik wo nyama so dol fang bije buka murrang ken dol soto wo nyama so ka tariyati nyala ni sukuru ka wol ti nyala ni sukuru kurangol soto no ikaje ko kam tako ni yemben ben dangol ta yi mari bulol so wala ben dangol te ki mari singol so i mari ko si fal fili balo kono iko yin complicational feel ni mari i nyin kurang bela i manta doctor ol jayi diagnose ye ke treatment plan na nyin complication ol be kan develop bari kaje ne nyin suute bala juna itata l'hôpital ye ke treatment plan ne doctor ol ya maro moy ikera boro tanyo nyama wado nyin complication ol ake slondile ibuke soto juna wado ibuke soto akaka wala nyama bari ni manta ye jaralo ni nyin ibe nyin soto la len kanyin men fote o kola je yaje ko nyin kurang sukur kurang na be molla imari ikataria sa infection or shotolale comme especially mol kes munada mentu le ka fa urinary tract infection e kol shotole juna la andu ni paramade singol to ni pulol to wa do paramo nyin ka kol yala pour ke jar comme nga fa nyam nyin sukur kurang akam blood vessel ni mol yelol ka bor silo men na kol fananti ka affect so ni bajala nuwol keta ye bajala hani borol ni pour wo yelol ye bor ani ye tawo baramol be damento so woka koleale so ibaje la hani ka boro ta pour wo jaralo nyaka kolea and infection ka tuta je because nyin jam sol ka trajen sukuro le nom so kana man toro ko je fuma yalla ko ni madi no man jarano madi wado kuran nyin ka janje balo kono ayelo la singoni wo bulol ni muta fo ibadwe ke amputate wala ko la to nyin tay ka kuntu bulol ni singol wadi ke kuntu because ni part of the body nyin ka fale because of jaralo ma so da je tisul nyin fata woni diabetes kuran ko kal so mbe musul yamara man especially nyin ka ta musul ni aje ko ni ila sumuna la lika problem o so je infection ka tra je ikatu sumuna la je ki nganya wala je ka wulen stuff like that kana total drong pharmaceutical cough tun gambia le bo nyambe ka cough le do da pharmaceutical borol se fay inyanta la tan ye kiskis because hanini sumuna la problem o amanka tun diabetes te boge kuran jamaat fana bi jasi pronto datle so bar ni manta doctor ol ya ye kisi ya lo membe le ita talo na fo diabetes te be da wala ne katu infection o sotla wala ku dole fana bije mem mamen ke diabetes te kisi lo drama ne ko bandino so be mol be ya marda especially gambiano na al sasa al tala bitar l'hôpital pour ye doctor oje so doctor is different from pharmacy technician or men kataraje to donc kajo kasia gambia ni mol sasa dal pharmacie to donc ngola kandemi ye fensa wala namso manken da westi kono ita pharmacie to fensa ala tra ita l'hôpital comme kanyin symptôme men foten comme ko be nyum fil diabetes munala jene singol te kendal diabetes sa kenol bar kuran dol fanan so fanan kenol bar ni manta mari manta doctorol ya ye kisi yalo membela abe difficult la pour ye mako jaralo so ni men sa ta doctoro ya flo yalon ko membela den nias ko establish ko nyine bela e sapero ke den wo safero niatra boro masro l'hôpital wala clinique o nyinto ibe rifala ita pharmacie o nyinto boro sanji boro ni sambi so ñing chronique sasa nabe melda important pour ye docteur oje especially ñing diabetes sukur kura ye docteur oje mi ala ko akira diabetes manage abalon nalako ñim boro is working for you wala ñim boro mantra wokam ñanta ñine falinna wala ñanta bordo la kafla je and stuff like that so binta son la katay jampa mbedan na janne next time pana nimutana mina killing ñim complication na nata imuta it is mone keno as a patient purusi fam kandi ñim kurangolma. So for those who doesn't speak Mandinka or understand Mandinka, I'll briefly talk about signs and symptoms of diabetes and gestational diabetes. So gestational diabetes usually is found in pregnant women, gestational, pregnant women. So it's usually diagnosed at, after 20 weeks, usually between 24 to 28 weeks when you go for your doctor visit. They will screen you for gestational diabetes. Sometimes people tend to have symptoms of diabetes when they are pregnant before the age before 20 weeks pregnancy. They have realized that most of those patients usually have undiagnosed diabetes, usually type 2 diabetes, undiagnosed, and they get pregnant. They tend to have symptoms earlier. But because most people who are pregnant usually wouldn't manifest symptoms of diabetes, it's across the board, the guideline states to screen everybody who is pregnant between 24 weeks to 28 weeks. They will screen you. And if they find you positive for diabetes, they'll put you on treatment plan. Because diabetes, gestational diabetes, can sometimes cause complications such as macrosomia. And sometimes people who tend to develop gestational diabetes, after delivery, they can continue to have type 2 diabetes. So it's important during pregnancy and after pregnancy to continue to see your doctor to monitor whether the gestational diabetes has resolved or not. If not, you have to continue with the treatment plan. And other complications that pregnant women can also have when they have gestational diabetes. They can be at risk for preeclampsia. So those are things that they can screen you for and make sure they keep an eye on you for you to be able to have safe pregnancy and safe delivery. Okay, signs and symptoms of diabetes. Last week we talked about type 1 diabetes and type 2 diabetes, and the symptoms usually include drinking a lot of water, peeing a lot, like frequent urination. Sometimes you lose weight because the body is unable to metabolize the glucose. So what happens? Your body starts to use the fat cells as an alternate source of energy. So you lose weight, you pee a lot, you drink a lot. And there are other complications that you can develop if your diabetes is undiagnosed or is not, your blood sugar is uncontrolled and you are not on treatment regimen. You can end up developing diabetic retinopathy, diabetic nephropathy, that's the kidneys that can be affected. You can also have diabetic retinopathy, means the eye, the retina is affected, and you can end up being blind. It also affects the nerves. You start having peripheral neuropathy, having signs of like a tingling to your feet and your hands. Those are symptoms of diabetes that you can develop. So my advice is anytime you see these symptoms, it's important that you see your doctor to be screened for diabetes. Sometimes people tend to have infections frequently, especially urinary tract infection, or they can develop ulcers to their limbs, like the hands and the legs. And sometimes it's really difficult to treat those wounds if your blood sugar is uncontrolled and if you are not on treatment plan. It can lead to amputation and also disability. So the symptoms and signs that I mentioned here, sometimes they can overlap with other illnesses or disease process. So whatever the case is, if you are sick, try to go and see a doctor, get screened, and you can have an established diagnosis and they can put you on a treatment plan. But we know that in our country, in Gambia, it is really difficult for people to see the doctor. Sometimes maybe they have long appointments and they get frustrated and they end up going to see the pharmacy technicians instead of seeing their doctor. People get sick, go to their pharmacy technician, just say, hey, I have headache or I have some infection down there. They end up giving them medications without further physical exam or testing to establish a diagnosis. I advise all of you, if you are sick or a family member who is sick, don't just go to the pharmacy technicians and get these medications. try to see a doctor, get tested, get an established diagnosis, and be on a treatment plan that can save your life. So we'll be back here next week to talk about some of these complications of diabetes and what you can do as a patient to help, prevent more issues or trouble for you when you're diagnosed with diabetes. Thank you so much.